All right, so of course, including Part A has to be Part B. So the federal government's going to refer to Part B as your medical coverage. I like to call it your outpatient coverage. So this includes services typically included that are less than 24 hours, such as professional services from your primary care doctor, specialists, or nurses. Any kind of outpatient surgery, treatments, testing, durable medical equipment. Which, by the way, if you don't know what durable medical equipment includes, it means diabetic supplies, wheelchairs, walkers, canes, oxygen, sleep apnea machines, anything like that. So, preventative services, ER, urgent care, and emergency transportation are just a few of the things that Part B covers. All right, so before we jump into the cost and coverage for Part B, we have to define something called Medicare assignment or assigned cost. I will be referring to it as assigned cost. So I don't know if you've heard of this before, but essentially assigned cost is the amount of money Medicare has decided that any doctor or hospital can charge for services performed. And it usually is about 10% of what the total cost would be normally for anyone else. For example, I have a chart up here so you can kind of follow along. Essentially, if a procedure, a doctor or the hospital normally charge $10,000 for a procedure, Medicare comes in and goes, no. This person covered by Medicare will only pay $1,000. And then Medicare is going to come in and pay their 80%. And you're going to pay your 20%. And essentially, it saves you a ton of money while giving you the same level of coverage as other people. So assigned cost really, really does help to work in your favor. It's one of the best benefits of Medicare. All right, so the cost and coverage provided under Part B. First off, in order to have Part B, there is a monthly premium of $164.90. That's the standard premium of 2023. Now, that could increase if you have a higher income, or it may be paid for by the state if you qualify for Medicaid. When you start receiving services covered under Part B, which again is outpatient services, you will then be responsible for an annual deductible of $226 a year. Once the $226 is met, Medicare is going to kick in. They're going to pay 80% of the Medicare assigned cost. We just went over that. They are going to pay 80% of the assigned cost. You will be responsible for 20% of the assigned cost. If in the chance that you are seeing a provider that doesn't accept the assigned cost, in other words, they don't have a contractual agreement with Medicare to accept assigned cost, you might be charged what's called an excess charge. In this case, the provider is still going to be required to accept the assigned cost. But since they billed Medicare and they don't have a contractual agreement, they are also allowed to charge an additional 15% above and beyond assigned cost. So if it's $1,000, that's $115 extra dollars out of pocket for you for seeing someone that doesn't accept Medicare. The good news is in Wisconsin, like 90% of doctors and hospitals accept Medicare. Now, the biggest upside to Medicare is the assigned cost. It severely limits the amount of money paid per claim, and that in turn reduces your out-of-pocket costs for each service. That said, there is a downside, and the big downside is that there's no maximum out-of-pocket with original Medicare A and B, meaning your out-of-pocket costs could be unlimited in a catastrophic situation or just a terrible year. You could just pay and pay and pay and pay, and there is no maximum out-of-pocket that you have to pay. So if that makes sense, let's move on to the next section.